Dr. Lewis with Spinal Health and Nutrition. Today, we're going to cover a very important topic that must be addressed today. It is the opioid crisis, or also known as the opioid epidemic. Now, what is the opioid crisis? It's the rapid increase of deaths and hospitalizations due to the overuse and overdose of drugs that fall in the category as opioids, okay? So what are opioids considered to be? And that's very important because whenever we go to a doctor or pain management specialist and they provide us with a prescription, we must know and identify what prescriptions or medications fall within the category as an opioid, okay? So an opioid are very moderate to strong painkillers known as hydrocodone, also known as Vicodin, Oxycodone, also known as OxyContin, Percocets, okay? And there's a very strong one called fentanyl, okay? Fentanyl is a very strong painkiller that derives from morphine or heroin, okay? Now, let's get into how does opioids affects the body, okay? It affects two areas. First and foremost, it affects the brain and also the body. But at first, it gets to the brain. It stimulates certain parts of the brain to increase our activity and wants people to actually want more of the drug, okay? There's a certain part of the brain that it stimulates, and I'm going to get into that part of the brain, all right? It makes our brain and body depend on the drug or the opioid for survival. How does it do that? So when someone is in so much unbearable pain, they feel like they just can't make it and not going to be able to survive, the opioids have a tendency to block the pain receptors. Whenever we're in pain, the brain has a tendency to release pain signals. When those signals hit the receptors, that's when we feel pain or discomfort on a certain area or part of our body. But what the opioids would do is it will block those pain signals so that we will not feel that much pain at all. Another thing that it does is that when it going back to stimulating certain part of the brain, causes a huge spike or surge in dopamine. Now, what does dopamine do to us? It helps us feel the sense of pleasure, satisfaction, motivation. So that's why it's called the reward center of the brain. Okay. Now, after the levels of dopamine go from a peak to a decline, then we feel that pain again. Okay. We feel down and depressed because once the body flushes the opioids out of our system, now those pain signals from the brain starts to enter in those pain receptors. We feel that pain all over again on a certain part of our body. And also we feel depressed again, down depressed because the levels of dopamine are going to decrease. Now, eventually our bodies will get used to the opioid, causing us to be more susceptible to actually become more addicted to it, okay? All right, so women are more affected than men with this. Now, here's why. Because of the pain that they go through with pregnancy, especially with post-pregnancy, okay? Studies have shown that during the pandemic and either after the pandemic, the percentage of domestic violence have increased, percentage of rape have increased. So that's going to cause more pain when it comes in terms of the women. Men are affected due to overuse, wear and tear on their bodies, hard labor on their job, depending on what type of job that they have. Former military veterans, so they go through the basic training, they're going to have a lot of wear and tear on their body. So they're going to be taking opioids, all right? Studies have shown that since the year of 1999 through 2010, there was a huge surge on opioid addiction when it comes to women, all right? Another high percentage as far as opioid addiction adolescence. Now, here's how. Now, before children become teenagers, they have a rapid growth on that certain part of the brain that I'm going to mention called the mesolimbic system. The mesolimbic system is that reward system that I want to address. That's that area of our brain that releases the chemical dopamine that will cause children to feel, they have the feelings of satisfaction whenever they achieve like small rewards, and also encourage them to learn more and also encourage them to be more motivated. Now, when they reach the adolescent stage, that mesolimbic system or reward center that's part of the brain will eventually plateau, and then it starts to get a decline. When that happens, they no longer feel motivated. They're no longer eager to learn. They no longer feel that feeling of satisfaction. So what do? They go for some sort of psycho substances to help to stimulate that reward center. Okay, so now we got two things that are going on with adolescents. Not only that the reward center is on the decline, but adolescents' prefrontal cortex is not completely developed. That prefrontal cortex which is another part of the brain. It helps governs our motor control or control impulses and also our decision making. There's two things going on with adolescents in their brain. A underdevelopment of the prefrontal cortex and also the reward center being on a decline. That will cause them to have impulsive behaviors, uncontrollable addictions for the drug, and also they're gonna definitely seek more of the opioids to have that feeling of pleasure or reward, okay? Now, according to the CDC, studies have shown that 53 million people from the age of 12 and older are addicted to opioids, okay? Now, these are the signs and symptoms that we must see if we suspect that someone is involved with these type of drugs here, okay? Especially if you have teenagers in your home or you have a best friend that said there's been some changes in behavior, okay? Knows that they're spending more time alone, losing interest in certain activities, especially with children or teenagers, quick mood changes, sleeping at odd hours, getting in trouble with the law, and also financial hardship, all right? Now, how does opioids cause this death or eventually to be fatal? Now, opioids affect several systems of the body. It affects the cardiovascular system by stimulating or increasing the heart rate, the gastrointestinal system, which leads to constipation, the immune system, but here's the big part that causes death. It affects the respiratory system. Here's how. Whenever there's a high dosage of opioids, the brain releases a signal that shuts down the respiratory system. And we know that the respiratory system helps control our breathing. That's where our lungs are. Now, when that respiratory system shuts down, that's what leads to people having deep breathing, and eventually they will stop breathing, leading to being in a hospital or death if left untreated. So we see that happening to someone that we know, someone that we love. We must address this immediately. Just immediately call 911, okay? Treatments. Once again, someone who's involved with these opioids and they are not following the correct dosage. There are some local treatment programs in every area, okay? We have to be proactive with that. Parents, if you have teenagers and a doctor has prescribed you with opioids, if you have pain, please keep those medications in areas where your children will not be able to get to. You do not want your children to have easily access to it. If you suspect that your teenage son or daughter is involved with opioid, be proactive, ask questions, be observant of the signs and symptoms, okay? And also encourage that child to get involved in some sort of program so they can get off those opioids, all right? And I encourage each and every one of y'all to get involved in some sort of alternative healthcare treatment to help stop the pain that you're having. Chiropractic treatment does help with someone who's in chronic pain. Acupuncture also helps with someone who is in chronic pain. All right. So please, let's take action with these drugs. If you are taking opioids, please follow the correct dosage. I know these drugs have a tendency to make someone feel good because once again, it stimulates and releases a high amount of dopamine to make us feel good, give us a feeling of pleasure, excitement, motivation. But we must think about the consequences. It will cause death and hospitalizations. Okay? Once again, I'm Dr. Lewis. Please like, subscribe, and share our YouTube channel. And remember, your health is your greatest investment.